Okay, this is Dr. Jordan, Tammy Jordan, from Middleburg, and she is evaluating Hope for us at Cheers Ranch. She's worse than the one I got last year that I have. She was on Craigslist for free.
She's got a pretty significant flow murmur, and it's probably related to the fact that she's anemic. Did you deworm her or anything?
Not yet. I was afraid to give her any kind of wormer yet because she was so poor. What we've been doing is feeding her 4 times a day, little increments at a time. You know, with some beef pulp and, yep, half beef pulp and half pellet.
And you see her respiratory rate's up at about 40 right now.
Right.
She's got heaves. And obviously she's having to work real hard to get air, and that burns lots of calories. Hematoma,
Okay.
and it scars the ear down, and that could have been from her itching, it could have been from damage from another horse, but it's definitely the cartilage is broken in the ear. That's a cosmetic issue. It's not hurting her now. That's a cosmetic issue. See in your mouth, baby? Huh? See in your mouth? Her temperature's normal. You know, she's don't snort in my face. Let me look at this side. I know.
She's so sweet.
You got hay all up in your nose. I guess you've been burying your nose in there. I'm gonna grab your tongue. You're probably not gonna like it. Let me look. Remarkably, the teeth aren't that bad. I'm sure they haven't been done, but remarkably.
Well, we had her feet done, so don't look at the feet and say that. We had her, Troy Hancock did her feet last week.
Remarkably, her teeth aren't that bad.
How old do you think she is?
Oh.
Yeah, she's up there. I know that.
25, 26.
Oh, gosh.
Because Galvania's groove's already gotten to the end and going back. And her cups are very worn. She's aged, but I would put her at about 25.
Yeah.
Okay. You know, her major issues are obviously poor nutrition. She's got terrible rain rot, and that all goes along with the poor nutrition. A horse with good nutrition can get rain rot as well, but it's more common in a horse that hasn't been cared for appropriately. You know, her body condition score is about a 1, which is emaciated. Heart rate, respiration are up a little bit, and that's because she's got heaves. Okay. But her temperature is normal. There's no signs of any infection. She does have a dramatic flow murmur, and is most probably related to anemia. You know, without blood work, that's the most common thing to cause this because it's bilateral, and it's a holosystolic murmur, which means that every beat, throughout the beat, that you can hear the flow murmur. So, you know, treatment-wise, we surely need to do some parasite control on her, and she needs to be put on iron supplements, B12 and iron supplements.
I have her on Red Cell right now.
Perfect.
Okay.
Perfect. That would be what I would recommend. Okay. Probably would be beneficial for 4 or 5 days just to go ahead and put her on B12 injections as well.
Okay.
Okay. You know, could she be anemic from poor nutrition? Yes, she could. It's very common that these horses are anemic. Most of the time we can correct their flow murmur by correcting their hematocrit. and their red blood cell count. We put them on B12, we put them on red cell, we increase their nutrition and make sure they don't have a parasite issue. Okay. The only thing she can be wormed with right now is Safeguard. Her health is not good enough to use anything stronger.
Okay. Give her 1 tube now, you think?
1 tube of Safeguard now. Wait about 3 weeks and then use a regular ivermectin. Okay. What we need to do is do a slow progression to killing her parasites. Okay. So that would be the regimen for her, and obviously your nutrition, feeding her slowly. It'll help us to control her heaves, to put weight on her. The most effective way to control the heaves is steroids. She has heaves, which contributes to the calories she burns just standing here breathing. Okay. Is it controllable? Well, yeah, it's controllable, but it's not curable. Okay. So, she'll probably do okay in the winter months, but in the summer months, she's going to need a little help with some steroids. Okay. So, those would be the things I recommend, for the short term, until you guys get her placed or something.
No, she won't go anywhere after this. It's like, where is she going to go?
Jerry, go ahead and get me a B12 shot. Go ahead and give her a dose of B12. The good thing is that she doesn't really have any signs of any infection or other than her skin.
All right. What about her, the edema in her legs, you think? The back legs? I know she had, she has cuts down on the bottom, like she got caught up in a fencing or something, but...
Edema is very common when we have low protein counts.
Is it?
Okay. If you notice, she's got a little edema in her pectorals too. Okay, and her chest muscles, and low protein levels come along with poor nutrition. Okay. So those things should correct themselves with proper nutrition. If she's not getting any protein, she's really going to have low protein. Okay. She's metabolized her whole body. She's eaten her whole muscle, all of her muscle mass up, trying to live. And that will come back as she's provided with enough calories that she gets turned out of a catabolic stage and back into an anabolic stage. I don't think she needs any medications for that. I just think adequate nutrition will do that for you. There are horses that have other issues, signs of other issues that we use things like anabolic steroids on. I don't think that's necessary in her case. She just needs to be fed. She just wasn't fed. You take a horse like this that has other health issues like heaves, and you turn them out, and even if you turned her out and eating grass, she's not going to maintain her body weight without calories, because she's burning them all up to breathe. So, overall, the issues with this horse are related to poor nutrition and not being fed appropriately, and complicated by the fact that she has COPD, or chronic obstructive pulmonary disease, which is commonly referred to by lay people as heaves. With the correct nutrition and treatment of the COPD, we probably can correct these issues in this horse.
Okay. Well, thank you, Dr. Jordan.